Hello everyone, my name is Dr. Vasu Kakarlapudi with Advanced ENT and Allergy. Each week we take your questions and we answer them. On this episode I will be discussing singing with a thyroid nodule, causes of vertigo, and muffled sounds coming from the ear.
Should a thyroid with nodules bother my throat if singing?
In general, a thyroid nodule should not really affect the singing voice unless the thyroid nodule is of sufficient size to invade into the nerve that controls the vocal cord movement, which runs right along the undersurface of the thyroid gland, or if the nodule is big enough to affect the movement of the voice box in general. I would say that if the nodule is less than about 2.5 to 3 centimeters in size, the chances of it affecting your singing voice is pretty low.
Is there a cause of vertigo, and if so, what can I do to avoid it?
Vertigo has multiple causes. The balance system is a very complex system and is composed of 3 major inputs. One input is from the eyes, which track your surroundings, your ears, which sense your head position, and different receptors in different parts of your body that tell your brain where different parts of your body are. All of that information gets sent to the brain. The brain processes that information and then determines movement of the body. So vertigo is simply a problem somewhere along that cascade of information, and so the challenge is to try to help determine where the problem is and then determine the appropriate treatment. So vertigo is a symptom that needs to be investigated as to where it is coming from.
One of my ears feels like I'm in a tunnel when I talk. It's like having a pocket of water in my ear after swimming. Anything I can do to help?
This problem is typically due to an issue with the tube that goes from the nose to the ear, commonly referred to as the eustachian tube. So the challenge is to try to determine what is causing the eustachian tube to not work properly. Some of the common causes of this are viral infections, allergies, sinusitis, and any type of environmental exposure that may not be allowing this tube to open appropriately. In terms of treatment, the best way to treat this is to determine which one of those things is contributing to it, and then we can use a variety of things to kind of help alleviate the pressure in the tube that goes from the nose to the ear. And these may include topical rinses for the nose, steroids, decongestants, antihistamines.